very good afternoon and a warm welcome to UBC Lunchtime News. It is the 26th day of June 2021. I'm Lauryn, Masika, Kazimoto, here to bring you the news. Now we start off with our first headlining story. President Yoweri Museveni has said the main aim of the lockdown is to reduce the numbers coming together that would escalate COVID-19 infection. President Museveni was leading Ugandans into a moment of prayer at State House Entebbe to seek for God's intervention in the fight against the deadly virus. Take a look.
The Archbishop of Canterbury came here. He wanted to greet me. I said, no, sorry, I didn't shake his hands. And after, by that time, I had not announced the lockdown. I did not shake the hands of the Archbishop of Canterbury, no. They said there was blessing there. I said, no. You keep your blessings. I will not shake your hand. And when we did that, because we did that, you hear now that even now, even with the carelessness, 800 and I don't know how many people have died now. 800 and how many? 800? 846. In 1.5 years. And most of them are in the last few weeks. Because before, it was only 300 people who had died in 1.5 years. In New York City, more than 1,000 were dying every day. For us, we are talking of 800 in in almost 2 years. Why? Because we had listened. We had listened to the command of God in the book of Genesis, establish dominion over nature. Establish dominion over creation. This is a virus. It started, but we quickly knew how it behaves. And we told you, we told everybody. But people don't listen. Whatever man sows, that's what he reaps. The biggest problem is not doing our mandate of using the knowledge which God gave us, the superior knowledge. Science is understanding the work of God. That's what science is. When you say gravity, I'm not the one who created gravity. These viruses are part of nature. And we, as people who are created in God's image, we know, or we can know, how to deal with them.
Now, market leaders in Kalere have been advised to embrace sanitation to avoid risks associated with the spread of COVID-19. The Minister for Health, Dr. Jen Ruth Acheng, appeals to locals to eat moderately, warning against the misuse of concoctions against COVID-19. This was during distribution of mosquito nets at Kalere Market, where the Prime Minister, Robin Anabanja, urged vendors to embrace the SOPs to avoid getting into ICU.
Right Honorable, I have two requests to the market leaders. One is about sanitation. COVID and sanitation go together. Let us ensure that the toilets are clean, even for the people who are staying here, and that water is available, because they need to wash hands at all times.
The place around Kalere Market is busy, but not without caution. The isolation by these fruit vendors is one of the clear indications that there is adherence to standard operating procedures against COVID-19. It is this kind of caution that Prime Minister Robin Anabanja emphasized as she arrived at Kalere Market in Kampala.
Maski yenu
bw'ogiteekako owulira tossa bulungi ni fakiti emalako emirembe naye tekyenkanankana ng'omuntu ali emulago ssaawa zino ng'aliira mu nseke.
This she said as she launched the distribution of mosquito nets to save market vendors from suffering from malaria.
Yes, our people are going through a difficult time. In fact, they are struggling to survive and also provide the foodstuffs to our people. And therefore, that's why the president directed that we give them bed nets.
The distribution of these mosquito nets is in line with one of the recent presidential directives against COVID-19. It was directed that market vendors spent their nights at their respective areas of operation. This created the need for mosquito nets.
I'm happy that today we have been able to cover Kalerwe, Nakasero is covered, and many other markets are going to be covered.
It is important that as we protect ourselves from COVID-19, we also remember that there are other disease conditions and we seek medical care accordingly.
Similarly, Minister Jane Acheng warns against misinformation on COVID-19 concoctions, warning of possible health consequences.
I want to make a humble appeal. Please, take lemon as you were doing before. Tangawuzi in your tea or food as you were doing before. Avoid this mixing everything, blending, and taking very toxic substances. We don't want the pandemic to go, then you have other diseases.
At least 620 mosquito nets have been distributed in Kalerwe Market, a gesture welcomed by vendors.
naye ensiri zibadde zituluma emisujja gibadde gitandise otulumba nga tulina okweraliikirira omusujja okulumako ga nti covid atuuse naye tulina essanyu okubeera nga gavumenti etukoledde enteekateeka y'akatimba bannaye tweyanziza bannakaleero tukikubirako mu ngalo.
The Ministry of Health is targeting distribution of 5,000 mosquito nets in Kampala to avoid risks that come with effects of malaria. Henry Okurut, UBC.
Yes, the State Minister, the Minister for Health, I beg your pardon, emphasizing on avoiding the concoctions, the different concoctions to avoid getting COVID-19. Now, a number of Ugandans have died in hospitals due to COVID-19, and many are currently battling for their lives in numerous intensive care units without family by their side, but with doctors and nurses in steady company of beeping machines. With unprecedented and intimate access, UBC TV goes inside the intensive care unit at Mulago National Referral Hospital.
The silence here is frightening, punctuated by a steady beep of machines doing what patients can no longer do, natural breathing. Inside these heavily sedated rooms, there are no visiting families. The health personnel brush the patient's teeth, change their catheters, and hold their hands in good and bad moments. This is the front line in the fight against COVID-19.
In the ICU, we tend to everything. If the patient is on a ventilator, that means mechanically ventilated. That means we have to make sure that they still continue to receive the appropriate levels of oxygen. We monitor that, we feed them, we make sure they are urinating well, we change their positions, we keep them, because usually such patients are kept in a medically induced coma.
Uganda is dealing with the negative consequences of the second wave of the virus, and in just 2 months, the number of infections has increased by 17-fold, whereas the deaths have also more than doubled.
Probably 1,000 patients tested positive, so that means we are more likely to get patients who will need high dependence unit services and ICU services. So in a pandemic of this nature, what will usually happen is the number of patients we are receiving are going to overwhelm the resources that we may currently have, and that eventually leads to more people dying. So over the last 1 week, We've admitted so many patients in our ICU, and they are all, as all ICU patients are, they are critically ill.
The situation is not different at the hospital's high dependence unit wards. The same is being reported at the private hospitals across the country, but those leading the fight against the deadly virus are optimistic that if the current measures put in place to retard the spread of the virus are observed, there will be a drop in the numbers and maybe, finally, light at the end of a long dark tunnel. Samuel Senono, UBC News.
More reason to stay safe and also continue to maintain all the necessary SOPs. Now, the Center for Health, Human Rights and Development has filed a case against government over alleged failure to regulate the exorbitant charges in the treatment of COVID-19 in private health facilities. In the suit, they say many Ugandans have lost their lives due to hiked charges of COVID-19 treatment in private health facilities.
It is alleged that in the most private hospitals, COVID-19 patients admitted to the intensive care is charged between 2 to 10 million shillings per day. Now Sehad says due to the hiked charges, families and individuals are struggling, with some have resorted to self-medication, which in turn affects their health.
I've seen people having COVID-19 and they can no longer go to hospitals. I just know a friend of mine, the mother got COVID-19, but because the private healthcare facilities were charging a lot of money, they decided to say, no, we can't go to a healthcare facility, and the lady died.
They claim that the rates charged by private hospitals are exorbitant to vulnerable Ugandans amidst the pandemic and in such tough economic times.
Some hospitals charge 10 million shillings for intensive care treatment, others charge 15. Recently, we had a story where a patient was charged 1.5 billion shillings, and now the hospitals are requesting for land titles and collaterals in treatment and management of the COVID-19 patients.
They have now filed a suit in the courts of law to compel the respondents to intervene and regulate chargeable rates for COVID-19 treatment.
And also the laws that we have assented to as a country, we have committed to ensuring that everyone should access healthcare services, irrespective of their economic standing in society.
So we are waiting for a date before the trial judge, and then the application can be heard. Since it's an urgent matter, we have also filed an application for a certificate of urgency, calling upon court to urgently convene and hear and determine this application expeditiously. So we now wait on the judiciary to come forth and join the struggle in fighting the exorbitant fees being charged by the medical practitioners in the country.
However, private health practitioners attributed the high charges to scarcity of medical equipments, oxygen, utility bills, and the work required in the intensive care unit.
Because government facilities get these things for free, but private facilities have to grapple with the supplier, with the medical stores.
So it's not even the cost of the refilling of the tank. It's about the logistics that are involved in mobilizing those tanks.
But the reality is to run a ventilator for 24 hours without switching it off not only affects your electricity, but also affects the ventilator itself.
Deborah Namamonde, UBC News.
Truck drivers under the umbrella Regional Lorry Drivers and Transporters Association has embarked on a campaign to train fellow drivers to comply set standard operating procedures against COVID-19. The chairman of the association, Byron Chinene, says the campaign is aimed at eradicating the spread of COVID-19 infection among truck drivers and their clients.
Chairman Regional Lorry Drivers and Transporters Association, Byron Chinene, says the trucker drivers are being sensitized against spreading COVID-19. As was the case in 2020 lockdown, the drivers are being trained on how to comply with the Presidential and Ministry of Health directives against COVID-19.
As you enter your truck, please make sure that you sanitize your hands before even you enter. Now, along the way, there are areas where we park. In our gazetted parkings, please, you have also to keep social distance by parking your truck, enter your truck. Your truck is your home. You have where you sit, you have a bed. There is a bedroom, sitting room. Please be in your truck. Don't visit people.
Byron Chinene encourages them to continue complying with the standard operating procedures and avoid transporting passengers, as this may put their lives in danger. He commended President Lauryn Museveni for allowing trucks to transport goods to enable social and economic development of the country. Chinene made the remarks at a media briefing during the launch of a sensitizing campaign of truck drivers, the importance of complying with the SOPs held at Lubigi Park in Wakiso district. On the issue of gazetted trucks parks across the country, as a presidential directive, Chinene encouraged drivers to avoid congestion in these parks.
We are having gazetted areas which our government is putting up. These gazetted areas, we don't want to see them congested with trucks, because there is that tendency of people putting up parkings just to collect money. They put their many vehicles, they come and get money. Please, government, help us this time. Don't congest those parking areas. If a driver doesn't want to park there, please let him go. Let him go. If he wants to be there, let him be there in a distance.
Some trucks drivers, however, have misgivings and necessary fear about the ongoing national lockdown. Story compiled by Salon Kasibanti.
Security operatives in Iganga district have banned BODA or motorist operations following frequent flaunting of standard operating procedures. The resident district commissioner Iganga, Thomas Matende, headed the operation.
BODA operators are among the public transporters whose operations were partially affected in a bid to curb the spread of COVID-19 in Iganga district. Their operation was only limited to transporting luggage other than passengers in observance of the set guidelines. However, in an operation mounted by security agencies in Iganga, BODAs who operate in stages were found not to be observing the standard operating procedures. The resident district commissioner, Iganga district, Thomas Matende, who headed the operation, explained that the move to dissolve BODA stages followed their reluctance to adhere to the standard operating procedures.
But it is becoming hard for us. Like, for example, the BODAs, they have come back to their stages, and they are there without putting on masks. These people had thought that coming back to their stages, they are going to lift only luggages.
Matende says the BODA operators have deliberately floated the guidelines, even when the district is registering a surge in the cases of COVID-19 infection. He says BODA riders have also continued to ferry passengers within the district.
Carrying people, at the same time they are afraid to put on masks. So starting from tomorrow, Friday, we are saying let BODA remain at home. And in case there is anything they need from town, they will be called by their clients.
The chairman BODA operators, Iganga District Muhammad Chimboa, says they have tried to implement the directives, though they have encountered a few challenges of handling a few stubborn individuals.
They are carrying sick people, they are carrying those ones from Obario, and the spread is just continuing. So we are saying if they can't lift the luggages, let them remain home.
BODAs have now been instructed to stay home and only move when they receive appointments from their clients, and also to respect the 5 p.m. curfew time.
UBC Lunchtime News takes a short break, but will return with business news.
Wait up, Tunamaliriza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday, but I can't find it.
You know there is a way of keeping all this in one place and available to you as and when you need it.
I really wish there was one, because the way these invoices grow legs and disappear.
I believe this is what you're looking for.
Now how did it get there?
Tabo! Do you know that with EFRIS, you can stay on track of all your business transactions and improve on your record keeping?
How so?
Kati tuli ku computer with EFRIS. I just search using the fiscal document number and I retrieve the records I'm looking for. Bookkeeping becomes simple after that.
Kapo, awesome, yeah.
I began using URS Kakasa Solutions and now I'm in charge of my business. And you can as well.
Kakasa, be sure you are in charge of your business.
Uganda Revenue Authority. Developing Uganda together.
Has anyone seen Bob?
Over here!
How did you get in there?
With my Airtel Money MasterCard.
But you don't even have a bank account.
Well, it's not a card. It's virtual, so no plastic, and it's safer.
But what are you doing there?
I want to buy Nancy a birthday gift, book my flight tickets, renew my Big Click subscription, and order shipment.
The Airtel Money MasterCard. It's not a card, but works just like one. Get one on the Airtel Money menu on your phone.
Welcome back from that break. We're glad you're still watching UBC Lunchtime News. Now, in our business news this afternoon, market vendors are already sleeping in markets next to their merchandise in spite of the vagaries of nature like coldness and mosquitoes. This follows a presidential directive that they don't move during curfew hours.
It is now 7 days since President Yoweri Museveni announced a national lockdown as a prevention measure against the fast-spreading COVID-19. The country now has another 35 days of lockdown in case the COVID-19 graph flattens. Though the president never closed food markets, he banned vendors from moving back and forth from their homes, ordering them to reside in markets.
It is exactly 11:45 p.m. here in Nakasero market, but just like you can see, it is a beehive of activities with different traders from different markets all over Kampala coming here to do the shopping.
In an impromptu visit to Nakasero market, vendors, however, complain of difficult sleeping conditions as they have to battle chilly hours of night and creeping creatures like ants and insects, among others. Nakasero Fresh Food Market is located in the center of Kampala city and does not have enough space for vendors to take shelter. The vendors have to squeeze within their stalls for a quick nap as they wait for daybreak. The vendors have to sleep in shifts for social distancing requirement. It is now 7 days since President Museveni announced the 42 days national lockdown, and vendors are yet to get into terms with the situation.
Abana wiki namba bali awakaboka ayo tulina okukola tujja kubeera wako otudde abaana balina okulya landlord abanja landlord wawaka abanja nowe Nakasera abanja looni zitubanja abaana bali waka kati nze ndi wano simanyi kiri waka nasanga omwana afunye olubuto nasanga omwana omusajja amwagadde tamusinze sirimu anoonya kyakulya sinafuna kuweereza mitwalo gugula kawunga ng'oli amuwa 10 ng'agenda yeggwera nga tamusinze sirimu.
Some market vendors have already received the mosquito nets that were recently given to them by the Ministry of Health following a presidential directive.
Okusookera ddala twandiroozezza nti gavumenti yeebale yatuwadde obutimba etuwe n'ebiveera biri ebisulwamu abantu.
Kulaba ng'abantu abamu tebali mu butimba, obutimba bwatuweereddwa lunaku lwaggulu. Era obutimba abantu abamu bakyabwaniseko mu bulabiko buli waggulu nga bawanise buyitemu empewo ate banaatuuka bukulaki buyingiramu.
Despite all this, however, the vendors claim the movement restrictions has robbed them of their customers.
Naye obuzibu
bakasitoma tebakyatuuka mu butale babalemesa okutuuka poliisi ebalemesa okutuuka ku butale bantu batono nnyo abakola ki abatuukako wano so nga abamu bandiza okukola ki okugula ebintu.
Tuli mu mbeera embi ennyo ennyo. Ekisooka bakasitoma tebakyalabika. Bakasitoma bandiza otugulako ebintu abapoliisi tebabakkiriza kujja kuyingira mu katale. Abakozi bannaffe abasobola okuva okumpi tugeze Wabbakuli Nankulabye Kibuye bwe batyo okutambula okujja okukola ku makya tebabakkiriza.
The traders seem to be observing presidential directives, including standard operating procedures to the hilt, as a guarantee for them to keep operating without infecting their clients.
Whereas the government has managed to provide sleeping mosquito nets to traders here in Nakasero market, their only plea to the government is that they should allow people to access the city so that they get customers who in turn can buy their products. Saddam Mubale, UBC News, Kampala.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
All right, and now into sports. Organizers of the Tokyo Olympics and Paralympics on Thursday unveiled a plan to deploy as many as 18,000 private security guards for the Tokyo Olympics per day, in addition to police forces in the entire period of the Games. During the events, private security guards will be deployed at 43 Olympic venues and surrounding areas alongside police forces. At present, a total of 553 private security companies are in charge of security at the venues and surrounding areas. The private security guards will not only be designated to patrol the main places and check luggage, but will also take up the function of directing traffic surrounding the venues. The organizing committee said the availability of manpower is ensured and that it has also made full preparation to deal with possible accidents. The spectator limit for the Olympic Games will be set at 50% of the venue capacity, up to a maximum of 10,000 people at each venue. If the COVID-19 epidemic continues to worsen, the events may be held without spectators, and the committee will adjust the number of security guards according to the actual condition. And with that, we come to the end of UBC Lunchtime News. Thank you so much for your company. Do enjoy the rest of the weekend. I'm Lauryn Masika Kazimoto.